Okay, I want to start again with another case. A psychiatrist, Nora, was treating a 28-year-old woman, Daniella, and Daniella thought when she raised her arm it was monsters who did so. And these same monsters also moved her legs forward and enabled her to walk. She used to cut herself very deeply into her arms, and she also stuck pins right into her legs so that they completely disappeared into her flesh, and she needed surgery to extract them. She also believed that she was the universe. When she died, the universe also would come to an end. When she was in the bath, she believed that the water and herself were one substance. She could never put on the same T-shirt twice, because once it had been against her body, it was contaminated. Her opposite belief was that when she died, the world would be rid of a bit of vermin. She couldn't talk to others because there wasn't any other to talk to. She wanted to die, and she was in an institution, and she loathed being in the institution that she was in. The psychiatrist, Nora, was a sensitive woman in her mid-30s, and she saw this patient just once a week for a 45-minute session. Nora was keen to understand why the patient believed that her arms and legs were moved by monsters, why she cut herself and stuck pins deeply into her legs, why she thought the bath water and herself were undifferentiated, and also why she fluctuated between believing that when she died the universe would come to an end, and at other times that the world would be rid of a piece of vermin. So slowly, bit by bit, each week a little more, Nora understood more and more of her patient's delusional world. She believed that it was possible to make sense of this madness, and indeed did manage to make sense of a great deal of it. And of course, it's a sort of paradox, but once you've begun to make sense of it, it becomes less mad. And a very important thing, I think, was that Nora's recognition of this, I think one needs to sort of realize it has a transitive effect. So it actually affected Daniella, the patient. And this is before any words have been spoken. The mere recognition is a sort of transitive, has a transitive effect. It's very important, I think, when realizing with treating patients of this sort, that the actual mental state is transitive, whether it's attention, recognition, realizing something, they're all transitive. Now, after a year of treatment, which was, as I say, one 45-minute session once a week, Daniella, she knew that her own body and the water in the bath were two different substances. If she used a deodorant on her body, she was able to put on the same clothes more than once. And she was able to talk to others, and she had the realization that others were separate from her and were truly other. She wanted to live and no longer wanted to die, and she was also satisfied to live in the institution, and she no longer sank pins into her legs. Now, I think the key to understanding was the patient's belief that she was the universe. Because in this belief is a huge grandiosity on one side of the coin, but on the other side, where is she herself? If she, Daniella, is the universe, she herself is really a nothing. It's like a merged type of a state. So she, as an individual, disappears. And so in that state, she has no power within even to move her own legs or her own hands. So she has to have monsters to move her arms and legs for her. But then you have to ask, well, why does she think she's no more than stinking vermin? And I think shame is the key here. But what is the shame exactly about? Now, we're all born with the possibility of an autonomous center, a center which is the source of my actions. But if this is only in an embryonic form or state, then there's shame. Shame sort of registers the sense of a wholeness that is not fully realized. So, for instance, I remember once I was treating a man who, like Philip Carey in Somerset Maugham's novel of Human Bondage, he was born with a club foot. And he was ashamed of the deformity, and it was not anything due to, he was born like that. But nevertheless, the shame of it. So it's connected to a sense of if something isn't whole or isn't fully developed. And this is both if something is physically not fully developed, but also emotionally. And so voice tells Daniella that she's just a filthy sewer rat. She's a piece of vermin, and the universe will be a better place if she dies and gets rid of her. But you see, I think that's a sign you nearly always have with these very disturbed patients, a very, very severe superego. But I think the important thing is to realize it is a sign that there is something undeveloped or not fully realized emotionally. So just to go back on what I said, Daniella believed that she was the universe, and in one way this is very omnipotent, yet it is an omnipotence that's trying to compensate for a state of affairs where Daniella is merged in a sensual way with the whole universe. Now, I want to stress that it's a sensual way. It's like a mental unity with the universe is fine, because a mental unity respects the diversity and the individuality of every sort of bit of the universe, including, like in this case, the person of Daniella. But if it's like a sensuous merging, then the individual differences all just get totally annihilated. And so that's the situation that Daniella is in. And it alters, it actually changes her perception too. So she thinks the bath water and herself are one substance. She can't differentiate it. But it's because she herself is not differentiated. But what I want to stress is that it's like something that comes to compensate and for something that's undeveloped. Now, the question, though, is, what is it that might be undeveloped? It may be that I lack empathy, or I may lack sympathy for others, or I may lack imagination, or I may lack the capacity to be aware of myself. It may be that my capacity to know the inner principles of understanding is undeveloped. Or it might be that I cannot match language to my emotions. I'm just throwing out examples of what it might be. And it's sometimes quite difficult to realize that something of this sort may be undeveloped. And for instance, I've come across quite a few people over the years who aren't actually inwardly able to relate to somebody. It takes time to realize that that isn't well developed, and a whole lot of then manifestations. But you'll always find that such a person has a very powerful superego.